There are many different forms of heart disease, but the reality is that heart disease is a chronic condition. Usually it's not one event that caused the heart disease. It's something that developed over time. Hypertension, resistant hypertension, putting pressure on the heart is one of the main causes of heart disease. We are designed to be able to undergo stress. That's why we have a fight or flight response. That's why we have a survival mechanism. But if we do not balance that out with the proper amount and the proper quality of sleep and rest, we are going to be in overdrive. And that's essentially what hypertension is. When you sleep, you're in a different state of consciousness and your physiology is different. There's something called physiological dipping of blood pressure in sleep. And a lot of people, their blood pressures don't dip when they're sleeping. And that is the most accurate and definitive indication of the likelihood to develop heart disease. If you have sleep apnea, if you have restless legs, if you have bad quality sleep or you're not getting enough sleep, you increase your risk of high blood pressure by 3 times. You increase your risk of a heart attack and a stroke. If you have severe sleep apnea or you sleep less than 5 hours a night, your risk for having a cardiovascular event is more than 30% in the next 10 years. If you're on 2 or 3 blood pressure medications, if you're overweight, if you're on cholesterol lowering medications, if you're developing kidney problems, if you're having headaches, these are all signs that your sympathetic tone is too high. You got to bring that tone down. And that's essentially what we do with our sleep.